Hello, my name is Anna Zinnel, and this is my presentation titled Optimizing BMT Caregiver Success for the class Quality Improvement in Healthcare at A.T. Still University. So let's jump right to it. The focus of this presentation is to discuss caregiver burnout as well as caregiver success rates while their loved one is in a BMT or a bone marrow transplant program. The significance of this is caregivers often don't understand the requirement, the commitment, the socioeconomic impact, and the psychological impact of what being a caregiver really means and all of the requirements that go along with being a caregiver. Oftentimes, caregivers have to completely put their lives on hold for many months while they are taking care of their loved one. A study conducted out of the Seattle Cancer Care Alliance found 3 themes amongst caregivers: psychological impacts, whether positive or negative, coping strategies, and roles and responsibilities. Overall, what they found was that there were a large amount of psychological impacts on these caregivers, and they were predominantly negative, stating that anxiety, worry, fear, and overwhelmness were the most common emotions that caregivers were feeling while they were going along with the BMT process with their loved one. So, what is our current procedure for educating caregivers? We'll go more into that in a few slides here, but I can tell you for one, it's very brief, it's assumptive, and it's not personalized. So, an article from the Palliative Care and Supportive Care Journal aimed to evaluate whether certain demographic factors were associated with better preparedness, and if this directly influenced the negative impacts of caregiving. What was found was that those with higher education were more likely to be better prepared for caregiving and also had less negative impacts of caregiving. So, what can we do? I would like to see some change. I would like to support, educate, and empower our caregivers much better than we currently are. Here we have a cause and effect diagram where you can clearly see some of the factors that may cause a caregiver to leave the program or not be as successful in the caregiving program. Our current practices at our institution is that a patient comes in for transplant and they are required to bring their caregiver with them. During this appointment, the caregiver education is taught. It is told to them that their timeline is that they need to be with the patient 24/7 for the first 100 days following the bone marrow transplant. They provide all medical transportation or transportation to anywhere. They are responsible for medication management, line care, and then feedback to their medical team. This can often be very overwhelming for caregivers, and what I've mostly have found is that it's the timeline. These caregivers have to completely put their life on hold, and I don't think they fully understand what 24/7 always means. So, what I would like to do is to create a educational module that goes much more in depth of what the caregiver role includes to better prepare our caregivers so that they can be empowered. So, what is our plan? We're going to have the department chair who will be overseeing the entire project. We'll have one attending acting as the team lead, 2 PAs, 1 nurse coordinator, a social worker, and an inpatient charge RN. Ideally, what would happen is that each person of the team will be assigned a topic that they would like to create some slides for. And at the end of the project, we would like to combine all of these slides and create a full educational model that can then be presented to the patient and their caregiver. So after we've assigned the roles, the team will go back and start working on their slides. I would like to have the team meet once a month over the next 3 months, and also bi-weekly via email. At the end of 3 months, I would like them to submit their deck of slides, and then we can combine them together for the finished product. Next, our plan is over the next 6 months, we will present this presentation to our caregivers. The caregivers will be required to take the caregiver education class, and then following the education class, they will be required to take a post-course survey, initially right after the module in person and again at day 100. Based on the survey responses, this will determine if the educational course was found to be beneficial to caregivers and if it improved caregiver satisfaction. We will address any outliers that were not a part of the planned cycle. Based on the outcome and its significance, we will either continue the educational program as is, or we'll make adjustments to the course material. The next PDSA cycle would be to launch this educational series along with a caregiver support group that we could then empower caregivers with the knowledge and skills for successful patient care and caregiver satisfaction. So to start this off, let's first talk about the post-educational module caregiver survey. Presented on the next slide is the just-in-time survey, and the purpose of this would be to fully understand the strengths and weaknesses in the caregiver course. Depending on the responses, if there were areas that were consistently identified as needed improvement, we'd be then to further adjust the education accordingly to improve those survey results. Here's an example of a couple of questions that would be presented on the survey. Caregivers will be asked to answer these questions immediately following their educational module, and they'll be asked to rate on a scale of 1 to 5, 1 meaning they have many questions regarding the expectations, and 5 meaning they fully understand the expectation. Again, this is not an exhaustive list of all the questions, but it's a starting point that we could certainly then tailor the educational content to what caregivers are looking for. The survey would need to remain anonymous with no patient or caregiver identifiers. Inclusion criteria for taking the survey would be caregivers at the University of Minnesota Bone Marrow Transplant Program. The survey would be created on a printed document to give to the patient and the caregiver directly following the education course that would be rated on a 5-point scale. The education level of questions would be at the 6th grade level, and ideally, the survey would be available in multiple languages so that this could accommodate non-English speakers. So far in my research, I have not come across a study that utilized a just-in-time survey questionnaire following an educational model specific to BMT teaching. However, I found several studies that utilize survey methods to monitor caregiver burnout. A study by Jan suggested that caregivers of patients undergoing BMT are at high risk for mental health disorders and cardiovascular risk disease compared to non-caregivers. The study aimed to discuss caregiver experience peri-transplant as opposed to post-transplant caregiver burden. The study suggests that caregivers were initially screened pre-transplant to ensure they were mentally and physically capable of providing post-transplant care the BMT patient would need. This is an area of our program I believe could be improved. So how are we going to implement this? We will initially, to recap, follow the PDSA cycle to create an educational program that we can then deliver to caregivers. In fact, a pediatric BMT program developed caregiver classes that met weekly, and if caregivers were unable to attend, they could receive individualized courses that would align with their schedule better. It was found there was a greater parental experience scores as a result of these courses. However, they did not evaluate the readiness of caregivers upon discharge. This is also our goal, to educate our patients and their caregivers. And to do this, we'll be utilizing the PDSA model. This is an appropriate tool that clearly lays out a timeline and creates a set of goals that are concise and to the point that leaves little room for questions. The management tool, this just-in-time survey, is beneficial because it is relatively easy to deliver, there's very little time commitment, and there's no physical risk. Limitations would include it's not an exhaustive review of the material covered, and if there's any language barriers. All right, and that's it. Thank you so much for attending this presentation. If you have any questions, please reach out via my